There may be a new clue for doctors trying to diagnose the coronavirus. Some patients say they lost their sense of smell and taste. 33-year-old Jason Knoll has the virus and told us this is what happened to him.
I lost my sense of smell and taste a few days into my symptoms. Honestly, I didn't realize it at first. I had, the flu or a cold, and so I felt like maybe I just was stuffed up and I couldn't taste very well. And then it was I was adding cayenne pepper to a dish that I was eating, and I realized that all I could taste was the heat. I couldn't taste the actual pepper. I was a little bit scared, honestly, is this permanent? I don't know. Nobody really knows.
Knoll says he's recovering and slowly getting his senses back. Our Dr. Jon LaPook joins us now from his New York home. John, good morning. What more do we know about these? What more do we know about these new possible symptoms?
Well, it's been fairly common. We've been hearing it on and off over the last couple of weeks that people can have this this loss of smell. And the question is, how long does it last? So I reached out to some ENT people last night, and they said, they've seen this with other upper respiratory infections, and it can be transient, but in some people it can be long-lasting, or in some people it doesn't come back. So right now this is all new, and we don't know if it's true for this new type of coronavirus. But I know people are concerned about it, but for now it's a clue, because if that's the only symptom that you have, it's a clue to say, I should self-quarantine because this could be the only symptom, and it's not of the COVID-19, and it's not a very common symptom, right? So I think if you lose your sense of smell, that's something that you should tell your healthcare provider about, and you should self-isolate. You should self-quarantine.
Yeah, fever is the one you really should be looking for. That's very common. But gastrointestinal symptoms is something else we're hearing about. I think that means different things to different people. So what should they be looking for in that context?
Well, this is right up my alley. I'm a gastroenterologist, and there was a study of about 200 people out of Hubei, China, and almost 50% had some GI symptom, but about 80% of that was loss of appetite. That's a little nonspecific. But 17% had diarrhea, and the diarrhea could be a prodrome. It could happen a couple of days before you have the other symptoms, so it could be the only symptom, and that's something for people to watch out for. Now, a much smaller percent, 2% had vomiting, 1% had abdominal pain. But it's the diarrhea. It's a new symptom. This is a new disease to us, and we're finding things out all the time.
John, the other day, the World Health Organization, the WHO, said that 80% of the people have mild symptoms. Number one, what does that mean exactly? And if you have mild symptoms, what should you do? Well, mild symptoms this time of year, when you have flu season, allergy season, cold season, it's anything from just mild sniffles, a little bit of fever, a cough, sore throat. Now we're hearing diarrhea. These are things that people get and they think, what is it, COVID-19, or is it just something that I've had in past years? And so I think what people are saying to do now is, unless you have severe symptoms, the severe symptoms being fever, shortness of breath along with the cough, you're just feeling lousier and lousier and lousier. Those are symptoms that you reach out to your healthcare provider and you try to figure out how to get in to see somebody. But if you're having these other symptoms, everybody wants you to stay home, because the last thing we want you to do is come into a hospital unannounced or a doctor's office unannounced and spread COVID-19 to other people. So if you do have these symptoms that you think that you may be having COVID-19, call somebody, whether it's your healthcare provider. You don't have that, call a hotline. A lot of the state departments have it, or call the emergency room and get some advice from a distance, telemedicine, or just on the phone. All right, Jon LaPook, I'm so glad to see you, and glad that you moved the shot a little. I was watching you yesterday on Nora's show, and all I saw was the O in the end. I thought, what does that say behind him? Now I see it says office. Makes perfect sense to me. Thank you.
People are learning more and more about us.
Yeah, there you go. Thank you, Jon LaPook.